there. Thank you for joining me once again as we continue our series of conversations around the COVID-19 pandemic. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we'll be looking at a new and emerging phenomena in the whole COVID-19 pandemic. And remember, if you have questions, you may send it to us by WhatsApp at 620-6275 or send an email to docandcovid@gmail.com. As usual, I will start off with wearing my mask correctly to cover both my nose and mouth, but then now I'll take it off using the straps and put it on the desk here. I'm alone in studio, so I pose no risk to anyone around me, and no one else here pose a risk to me. Now, we are looking at something that has recently been recognized and is gaining more and more attention as it relates to the COVID-19 pandemic. And this specifically is the whole concept of what is known as long COVID. Long COVID, as the name suggests, is when COVID persists beyond the expected time of recovery. So we are going to look at today the specific question of what is long COVID and why do we need to actually recognize it and how do we proceed. So what really is long COVID? It is the phenomena of not recovering for several weeks or months following the start of symptoms that were suggestive of COVID, whether you had a positive test or not. So you had symptoms that started on day one, and then several weeks after or months after, the patients may still have persistent symptoms, and that is long COVID. About 75% of patients who had symptoms of COVID, about 75% of those patients continue to have symptoms after recovery. So if you look at our own data in Guyana, we have by now about 4,500 positive cases. And if you imagine 75% of that, that's over 3,000 persons who would continue to have some kind of symptoms. It may not be the same severe or worst case scenario as when they first had the disease, but the persistence of symptoms can cause significant distress to people mentally and physically. And if you think about the social consequences, for example, persons who are known to have been COVID-19 positive, we have a culture sometimes of shunning these people even when they are fully recovered, and there's absolutely no reason or no basis to do that. But we still have, if that person, even a month or two after they recover and they're close to you, if that person coughs, it sets off some reaction that is not warranted, oftentimes unfair and may even be discriminatory. So 1 in 5, even the young persons who would have had COVID, 1 in 5 previously healthy young adults were not back to their normal, usual state of health even 2 to 3 weeks after their testing positive. So this is not something that the COVID-19 pandemic is not something that just starts and disappears in 2 weeks or 3 weeks. Even in young, healthy persons, it can linger in about 20% of them at the end of 3 weeks. For the COVID-19 survivors, there are significant long-term health risks. Up to about 20% of persons develop some kind of damage to the heart. And of course, there's a higher risk of heart attack in these persons. And it is thought that the whole inflammatory process that happens in a COVID-19 infection patient, that inflammatory process creates some unstable circumstance or conditions in the inner lining of the blood vessels of the heart. And once that inflammatory process creates that unstable environment, then clots can then form. And when the clots form, that causes obstruction of blood flow. And therefore, when there's no blood flow going to the heart muscle can die in a process we call a heart attack or myocardial infarction. So these persons can have an increase in their risk for heart attack even after they would have recovered from the acute phase of the COVID-19 infection. And that's a very scary thought to contemplate. The effects of long COVID is not just on the heart. It can be multi-systemic. It can affect from the head to the toe. And let's look at some particular areas that can be affected. Let's look at mental health problems. Can you imagine what it's like for a patient, for example, who has COVID-19 and is lying down in the ICU at Georgetown Hospital, for example? And you know by now we had about 130 deaths or so. Can you imagine what the reaction is like for you lying in a bed in the hospital and the person or persons next to you die and you have the same diagnosis as that person? Imagine the mental trauma, the anxiety, the anguish that is felt by that person. When they get discharged from hospital, that's not the end of that kind of anxiety and trauma. Many go on to develop disturbances in sleep. They have anxiety disorder. They worry about things. They have depression because they would have been in an environment where persons just like themselves with the same diagnosis died right in front of their eyes. And so that's a long-term effect that we are now coming to grips with. We are now learning how to cope with that. And I know that the public hospital systems are now putting things in place to be able to provide counseling and guidance for those persons, even after they would have been discharged, physically feeling better. The effects on mental health are quite serious, quite significant, and must be taken into consideration for each patient. The next major issue is things like lung scarring. Remember, this infection affects the lungs, and anywhere in the body that there is an inflammatory process, any damage that occurs, the body tries to repair it, but it's an ineffective repair process that it can actually repair it with fibrous tissues, which is not as effective as the normal tissue. So lung scarring and lung fibrosis is a potential long-term effect that can affect the amount of oxygen available to the body for energy production. Because remember, the lung is critical in exchange of oxygen going into the body and expelling carbon dioxide to the air. The next thing that can occur is liver damage. These are all chronic long-term effects. Persons can have continued shortness of breath, weakened heart muscle, and of course, because of chronic pain and fatigue especially, they can have significant restrictions and effect on their ability to move and exercise and carry on normal activities of daily living. So the features specific to long COVID are now emerging. We are now learning, we are now understanding how to better define this condition. One of the main things that persons complain of is profound fatigue. they're just tired. They're not able to move. They're just overwhelmed. And this is a combination of mental and physical. There may be a persistence of cough, breathlessness, muscle and body aches, chest heaviness or pressure. There may be a persistence of skin rashes, palpitations or your heart skipping a beat or an extra beat or fluttering. Occasionally, these persons may have a return of fever, headache, diarrhea, and sometimes they develop what is called pins and needles. That's a tingling sensation in your fingers and toes. A very common feature is the relapsing and remitting nature of the illness, where the patient feels as though they have recovered, then they're hit back again with the symptoms that first they recognized. And that can be a very depressing, a very distressing situation for patients. Remember, we don't know much about this disease condition yet. It is less than a year old, and we are learning a lot of things. So when a person develops these symptoms again, the number one question that comes into their mind again, oh God, am I getting COVID-19 again? Do I have to go back to hospital? Do I have to get tested again? What can I do? So it can be a very traumatic mental experience for these patients, and not just the patients, but their families as well and their loved ones. The emerging trends that we are seeing in long COVID, for particular patients, if you've got a persistent cough, hoarse voice, headache, diarrhea, and you've had to skip meal, you've had shortness of breath, if you've had all of these things in the first week of your illness, then you are 2 to 3 times more likely to get longer term symptoms. So the persons who become ill very early in their infection process, they are the ones who are likely to have long-term effects. Long COVID is about twice as common in women as it is in men. The women are affected more by long COVID than men. The average age of someone presenting with long COVID was about 4 years older than people who had what might be termed as short COVID. So older persons are more at risk of developing long COVID than younger persons. The common symptoms or things that people complain of after their initial recovery, and what we can now start to categorize as long COVID, they're very well recognized. And these are things like what we mentioned before, the extreme, profound fatigue, shortness of breath. Those are the top 2 long COVID symptoms. Joint pains, chest pain, coughing, a loss of smell. Important to note that a loss of smell and loss of taste in about 98% of persons who have these symptoms, this loss of taste and loss of smell will resolve by the end of the first month. So this is usually temporary. Then there are things like Zika syndrome. Zika syndrome is otherwise known as Sjogren syndrome, but essentially it's characterized by dry eyes, dry mouth. The mucous membranes are usually quite dry. Then other things like runny nose, red eyes, headache, coughing with sputum production, sore throat. All of these can actually continue to occur in what we call long COVID. So if we look at a particular timeline from the beginning of symptoms or beginning of the infection to recovery or death, we can see that most persons with mild symptoms would have recovered by week 2 to 4. The course of the disease can run from around 16 days after a short incubation period, and mild cases up to 10 weeks, given a long incubation period and worst case outcome. A person can be infectious before symptoms start and until symptoms are gone, with a peak about 5 days after symptoms onset. But this time frame is not very well understood, and some people with COVID-19 have no symptoms at all, yet they can infect others. So I wanted to brief you and to bring you up to date today on the new emerging recognition of this phenomena that we call long COVID, so we can better be able to understand those around us who may have had COVID, or you yourself, if you would have had COVID, then you will recognize this as a potential long-term occurrence in you. So remember, if you have any questions, feel free to WhatsApp at 620-6275 or send email at docandcovid@gmail.com. Thank you so much for joining us today.